We're all waiting for the day when we can conquer COVID-19 and our lives can return to normal. The great news is Health Canada has approved COVID-19 vaccines that can help us reach this goal, and staff, residents, and essential caregivers from long-term care and retirement residences are the first in line to receive it across Canada. As an employee, we understand you may have some questions about why it's important for you to opt into receiving the COVID-19 vaccine. Let's discuss some questions we've received that can help you understand the process and logic behind the rollout. We've seen firsthand in our residences the devastating impact of COVID-19 to our residents, their families, and our dedicated employees who are doing everything they can to help keep everyone safe. Due to high community spread in our local neighborhoods, it is becoming increasingly difficult to keep our residences free from the virus. Our residents are the most vulnerable population to serious infection and even death from COVID-19 due to advanced age, and in some cases, compromised immune systems due to medical issues or dementia. It is therefore extremely important that we all get vaccinated to protect our residents, visitors, and colleagues. However, it is equally important to protect yourself and your family from severe illness as a result of the virus. As more and more people get vaccinated, we will begin to build herd immunity, but if you personally aren't vaccinated, you are still at risk from becoming ill, as scientists have not yet proven that vaccinated individuals can't spread the virus to others. It is not mandatory to be vaccinated at this time. However, Public Health and Chartwell are strongly encouraging all employees who are eligible to get vaccinated to protect themselves. COVID-19 vaccines are currently being rolled out to select long-term care and retirement residences across the country, depending on your province's specific distribution plan. Some of our employees have already received vaccinations, and your home may be offered it very soon as well, or sometime in the early months of 2021. Local public health units and hospitals are in control of when a home receives vaccination, not Chartwell. Our understanding is that you may be contacted directly by a vaccination clinic, or your residents may be contacted and your management team will coordinate signups for vaccine appointments. There may be an opportunity to be vaccinated in the home during clinics for residents. If your home is currently in outbreak, you may be delayed in receiving the vaccine until you're given the clear from public health. If you've booked your vaccination, here are some tips to prepare for your appointment. Wear short sleeves or a shirt that is easy to roll up, as the shot will be administered in your upper arm. Have something to eat before the appointment to avoid feeling faint. Bring any identification required, such as your health card and photo identification. Also bring your immunization record with you to record the vaccination you're about to receive. And lastly, don't forget to wear your mask. While the Moderna vaccine can be distributed directly at long-term care and retirement residences, the Pfizer-BioNTech vaccine has to be kept at such a cold temperature that it requires special cold storage that is only available at some hospitals and dedicated sites. This is why if your home is offered the Pfizer vaccine, you may have to go off-site to receive it. It is totally normal to experience side effects from COVID-19 vaccines, as these side effects are typical of the inflammation induced by vaccines and are a sign of the body's immune response. These side effects may feel like the flu and may even affect your ability to do daily activities, but they should go away in a few days. In addition, side effects were more frequent after the second dose in the vaccine trials. You should monitor for these potential side effects after receiving a COVID-19 vaccine. Pain at the injection site, redness, swelling, fatigue, headache and muscle pain, or joint pain. Side effects are similar for both the Pfizer and Moderna mRNA vaccines, but could differ with other types of vaccines. It's important to understand that experiencing major side effects, such as allergic reactions, are very rare. In fact, only 1.3 out of 1 million doses administered have resulted in an allergic reaction. If you experience any mild side effects, such as injection site pain, tiredness, headache, or muscle and joint pain within 48 hours of your vaccine, you are still cleared to come to work, as these are normal. However, if your symptoms persist past 48 hours or are atypical, you will be asked to recover at home until you feel better, and you should consider contacting your doctor or medical provider for follow-up. Although you may be vaccinated before the majority of Canadians, it's important to continue to follow all public health precautions currently in place to protect others, which includes wearing a mask, staying at least 2 meters from others, and limiting and avoiding contact with others outside of your household. This is because scientists still don't know if vaccinated people can spread COVID-19 asymptomatically to others. This also includes following infection prevention and control precautions in place at your long-term care and retirement homes, such as participating in daily screening protocols, wearing PPE when required, continuing with proper and frequent hand hygiene practices, and wearing the appropriate PPE mandated by the government while at work. If you have any concerns about taking the vaccine, don't hesitate to speak with your Chartwell Director of Care, General Manager, or Health and Wellness Manager today for guidance.